Hello, fellow pterodactyls, and welcome to another episode of Low Tech Health. Today is Forgive My Foul Mouth Friday, and I'm happy to fucking be here. I'll tell you what. It's a beautiful day outside. It's the evening time, and I'm catching the golden hour, and I'm walking around. I'm seeing people. Businesses are opened up. We've got people sitting in restaurants again, and they're not wearing masks, which is good because they're eating, and it's also not good because they may be spreading it. Oh, what have we learned? What have we learned mid-COVID so far? Well, we've learned that masks actually do help, and that we can't really trust the CDC anymore to be credible because they came out with a fucking gaslighting program to try to preserve supplies instead of being straight with us saying, yes, masks do help, but please reserve the level 1s and N95s for healthcare workers at this time because there is more than likely a shortage. But I don't know, people wouldn't have abided by that anyway, so you gotta fool them, I guess. It just shows the pitiful perspective we have from our federal government and those in charge and the CDC of the general public and the lack of trust they have in us and us now in them. Also, nursing homes are filthy. We've known that. It's very, very poor how we've seen the spikes in nursing homes with this COVID because they're nasty anyway, and just goes to show how level of hygiene and cleanliness and being able to not stack people too close together benefits them. You can't grow people so close together. I know, as an ICU nurse, I do love my vegetables. I do. And there are countless patients that come to the ICU from nursing homes after they've called 911 because something happened with this, they've fallen, they've broken, and the staff, the nurse, the LPN, the care assistant, the CNA, certified nurse assistant, are apparently not allowed to pick the patient up after an emergency because it could worsen it. So they languish there and they get picked up and they brought to the ICU where what was a 10, 15 patient to one nurse assignment becomes a 2-to-1, 2 patient to 1 nurse assignment. And the ICU fixes them. We talk bad about nursing home nurses and how they miss this and do that, but there are like a handful who actually know what it's like in the nursing home, who have worked there before and recognize that it's just a numbers game. It's impossible to provide high quality care to that many people. So did COVID teach us that? No, we knew that. So what's the fucking solution? I don't know. Money. She goes over and over showing you that money seems to be helping people. The mortality rate is higher in lower socioeconomic status people, minorities. That has a lot to do with vitamin D they're seeing, because vitamin D provides a antihypertensive and anti-inflammatory effect. It's a hormone precursor. Very important. We don't get enough in the sun, and we haven't been getting enough while we've been quarantined, so double. At least where I am, they let us go outside. They haven't really ever stopped. Not like encouraged by the CDC, even from the very beginning, to go outside for a few minutes, like walk, at least in your yard, get some sun. Strange to think that there are places like New York, ones that hit the hardest, who don't have space to go walk in a yard. They don't have a yard. It makes sense that this virus has trounced them. So on this Forgive My Foul Mouth Friday, I have to relate back to Seinfeld and asking you, are you the master of your domain? Are you the master of your domain? And I don't mean in the way that they put it, the whole contest of not masturbating and see who can go the longest, but are you master of your domain, your temple? Are you taking into account how many people's breath you breathe day in and day out, and how you've been taking for granted that is a vector of disease from other people? Are you in close cubicles and spaces that you'd rather not be if you had a choice? I know people don't always have a choice to be in an office, but this hopefully woken employers up to see you don't have to pay for space. You can have people work from home. It's genius. Especially if they have good work ethic and you pay them enough, they have a space where they can separate their home and their office. It's a no-brainer. Save gas, save transportation. This is great. This is still a very good year. And I want you all to remember that no matter what happens, the lives lost are tremendous and horrifying. But we can learn something from it. We can gain something from it. We can get stronger as a people. And we can ask for forgiveness from our foul mouths of ourselves. Because sometimes you just gotta scream, fuck. Love you guys. Stay strong.